Hi guys, Dr. Crafts here with a ridiculously short summary of our autoimmune diseases lecture. We covered 4 autoimmune diseases in this lecture. The first one is lupus. And for this one, if you want to remember a typical patient, you should think about a young woman with a butterfly rash. However, there are many signs and symptoms that are possible in lupus. You can get everything from renal failure to pleuritis, which is an inflammation of the pleura, to pericarditis, inflammation of the pericardial sac, joint pain, everything, every organ system. But this would be the most common thing, a young woman with a butterfly rash, which is that skin rash that goes across the nose and involves the cheeks. The clinical course of lupus is typically a chronic one. It's a long-standing disease in most patients with relapses and remissions. So you get an episode of something and then it goes away for a while, and then you get another episode. It might be the same thing or it might be something else. There are anti-nuclear antibodies in this disease as in all the others that we talked about. The most specific one for lupus is anti-double-stranded DNA. Rheumatoid arthritis is the second one. This is a disease that, as the name suggests, involves mostly the joints, but it can be systemic as well. And the features that are kind of a tip-off that you're dealing with rheumatoid arthritis as opposed to some other kind of arthritis like osteoarthritis is that rheumatoid arthritis is typically symmetrical. It typically starts in small joints like in the hands, and there are characteristic hand findings like the fingers deviate towards the ulnar side of the hand. You might have a boutonniere deformity of the thumb, which is where you have a flexion of the proximal interphalangeal joint of the thumb and a hyperextension of the distal joint. You might have a swan neck deformity in other fingers, which is where you have hyperextension of the distal joint and flexion of the proximal interphalangeal joint. You can also have rheumatoid nodules, which typically show up on the forearms but can occur anywhere, and they're just they look like bumps in the skin, and they contain, if you were to do a biopsy, they contain lots of lymphocytes. This thing called rheumatoid factor is present in about 80% of patients with rheumatoid arthritis. It's an IgM antibody that the patient makes that's directed against IgG antibodies, which sounds terrible, but it really doesn't contribute too much to the underlying tissue damage and symptoms and signs in this disease. It is, however, useful for diagnosis. So you can, if you are wondering if a patient has rheumatoid arthritis, you can look for rheumatoid factor, just do a serological test looking for this antibody, and if it's present, that's fairly indicative of rheumatoid arthritis, although it can be present in some other diseases, autoimmune diseases too. If it's absent, it doesn't necessarily mean that the patient doesn't have the disease, because about 20% of patients with rheumatoid arthritis don't produce this rheumatoid factor. The thing responsible for most of the damage in this disease is a cytokine called tumor necrosis factor, and there's actually a drug that can be used that kind of blocks this particular cytokine and is useful in getting rid of some of the symptoms in this disease. Sjogren's syndrome is the third one, another autoimmune disease. Also, by the way, all these diseases are more common, all these 4 diseases are more common in women than in men, as are most autoimmune diseases in general. Sjogren's syndrome, the main things involved are the salivary and lacrimal glands, and so patients typically present with dry eyes and dry mouth, although there are some systemic symptoms that can be present too. The underlying mechanism is not really well understood, but there's something in the cells in these glands, some antigen on these cells in the salivary and lacrimal glands that T cells react against. Another important part of this disease that patients need to know about is that they have an increased risk of lymphoma. It's about 40 times normal, and it tends to show up in the salivary glands, so you can just test for that on an annual basis by doing biopsies. Last one, scleroderma. This one's really unique. The symptoms are very different than any of the other three we just talked about. The underlying symptom in this disease is, kind of as the name suggests, deposition of fibrous tissue in the skin. So sclero means hardening, and so whenever you see that, like atherosclerosis is hardening of the arteries, this is scleroderma, so hardening of the skin, and it's just deposition of collagen, or another word for that is fibrosis in the skin. Sometimes you can see it in the viscera too. There's two types of scleroderma, diffuse type, where you have widespread skin involvement at the outset, and pretty soon thereafter you have visceral involvement as well, so involvement of the organs. The limited type tends to just present with some mild and fairly limited skin involvement, maybe just the hands and the face, and it may not even progress to visceral involvement. If it does so late in the course. A couple of signs to look for. Claw hands are a result of the fibrous deposition in the skin of the hands that pulls the skin taut and makes the fingers curl into a claw-like shape. And then a mask-like face, sometimes with a restricted mouth opening, also due to the fibrosis in the skin of the face. So I hope this was helpful. Thanks for listening.